In an interview with Fox News, the president putting forward a 4 to 8 week timeline for this vaccine to come to market, although he didn't specify which one of the vaccine candidates he was talking about. Meanwhile, we heard from Bill Gates saying the FDA and CDC has lost its credibility because of political influence within the agencies. Let's bring in Robyn Gershon. She is a clinical professor of epidemiology at NYU School of Global Public Health. Doctor, let's start with your thoughts on the comments from the president today. There's been a lot made about how this process has been politicized. We heard the president say, that's not why I'm saying it's going to happen within 4 to 8 weeks. What's your takeaway from his comments?
Well, not only myself, but my other colleagues in public health are very, very concerned. Over the last few days, we're hearing from the Assistant Secretary for Public Affairs at the HHS. Now, this is a person without any health or medical background who is a political operative and proudly states that. And he's apparently telling CDC what to publish. He's telling FDA what to do. This is really eroding the trust of the public in both the CDC and the FDA. And this is a huge concern at this incredibly momentous time when we're getting ready to potentially launch a vaccine.
On that front, Doctor, we've heard from the big drug companies as well as the scientists within the FDA. They put out separate letters saying that we will not do this without considering the safety. We will not cut corners in this process to bring the vaccine to market. What do you think should be required to be submitted by these drug companies in order to ensure the safety of these vaccines? I mean, when you look at sort of what the standard process is there a need right now to go above and beyond that because of the skepticism that exists on the outside?
Not necessarily to go above and beyond because we have very stringent rules in place, but those were very unusual joint statements. 9 drug companies coming together just over a little bit of a week ago, and they're trying to make sure the public understands that they are not going to cut corners and they will not be hoodwinked into rushing these to market. Now, I think a very good development was when AstraZeneca took off their product they stopped the trial for a week. They were very transparent. They said there was an adverse incident, had to be fully vetted. It was, everything was okay, and they went back on. They're all well on their way to 30 or 40,000 people in those trials, and that does shore up the public's trust. So I don't think they need to do anything more, but they need to be very, very transparent about what's happening, and that's what AstraZeneca showed us.
You talk about AstraZeneca, another company that's in vaccine development is Pfizer. And on that front, we got some developments over the weekend with the company coming forward and talking about a need to expand its diversity, the diversity of its trial, expanding from 30,000 to 44,000. The issue of diversity is one we've heard a number of these companies, as well as Dr. Anthony Fauci coming forward and talking about. Can you help us understand why that's so significant, especially in a vaccine for something like the coronavirus?
Yes, and it was such a good development because they also said that they're going to be a little slower now because they are going to expand this trial. And I think it's imperative that we ensure that all people that are at risk, and we know it's mainly in minority populations, the low-income populations, we need to make sure that these people are not having any adverse outcomes that we're not seeing in white populations. So it's critical that they include those populations. And also, by the way, it means that it may be better, easier to get them to take that vaccine because right now, only about 40 or 50% of Americans said that they would, 30% say absolutely not. And a lot of the ones that say absolutely not are minority populations.
Why do you think that's the case?
Well, there is a general distrust across the board for healthcare, for physicians. It goes way back to a long time ago for unfortunate incidents in our history. But we need to get them engaged in this process of testing it, get them engaged in the rollout, and ensuring that it reaches all these populations that are quite arguably at the highest risk.
Well, the U.S., of course, not the only one in vaccine development. And on that front, we heard the UAE today come out and say they have approved the emergency use of a Chinese-made coronavirus vaccine. How should we be looking at all these developments outside of the U.S. as well? Several weeks ago, it was a Russian vaccine, which was met with a lot of skepticism. And now you've got a Chinese vaccine that's been approved for emergency use in the UAE.
It's a little worrisome because, all these 9 firms that came together for the joint statement, they all have said that they may ask for emergency use. So they'll come out ahead of, before it's fully vetted. In some sense, having these other vaccines out there is kind of good in a strange sort of way, because if there are adverse impacts, we will see them. They're rolling them out on a large scale, so we'll see them before our vaccines roll out. But people are very skeptical. They are very distrustful right now. We don't want to lose or erode any trust in our FDA, CDC, or our health officials. So taking a cautious approach, I think, is the best way for us to get full coverage as much as we can, let's say, at least 70 or 80%, which was what we need to have herd immunity.
And to your point about making sure that all the precautions are in place and everything is checked off, what kind of timeline are you looking at right now? What do you think is realistic for one of these vaccine candidates to come to market?
Well, for reaching the general public in my field, most of us are saying maybe next spring, by next summer, maybe it will reach people like everyday Americans. Obviously, healthcare providers will go first responders, those at highest risk. But remember, even once we get the vaccine, we know the trouble we're having right now with point of service testing for the antigen, which would be fabulous. A 15-minute test in a doctor's office or in a school or any place like that would be fabulous. And there are 3 great candidates now, but they're already, they can't possibly bring it to market in the amounts that we need them. They already have orders in the millions. So we're talking about 230 million or maybe at least 200 million doses. We need a huge infrastructure, and people are worried because of the testing so far, the contact tracing, and all these large infrastructures are hard to develop and to launch and to do it well. So people in my field, we're thinking maybe late spring. That vaccine, if in fact there's more than one, those vaccines will come and be available to us, to the everyday public.